For the marketing thought of the day, we're going to do a brief overview of how you can position yourself with physicians. And we're going to use a PR, marketing, sales approach, which I've found to be the most successful approach that I've used over my years of marketing to other physicians. So step number one is laying out your public relations. And the way to think about public relations is, you almost want to create a mystery, and in that you want to show results. So you're not necessarily saying we're the best physical therapy, we're the premier physical therapy, or anything like that. You're showing the results. So, Mary beforehand had 107 degrees of scaption. After treatment, she has 170. People have a very tough time arguing with results, and especially physicians who you may come up against, who you're trying to sell to, who are very skeptical of what you're doing, especially if they had a past bad experience in PT, and also realize that the average physician gets years and years and years of pharmacological studies, but has a few hours of PT exposure. They likely haven't been to PT in the past, and they likely have a problem that you could help them with. So the very first step is laying out your public relations, and you want to show them. So if you're going to do a mailer, you want to do it in the form of a case study. So here's Mary Jones, who presents with adhesive capsulitis before physical therapy. Here's Mary Jones 4 weeks later, 8 weeks later, whatever your program is, and here's the results afterwards. You want to do it in a very very easy format for the physician to read, and you want to get that out as often as you can. That lays the groundwork for your next two steps. The second step is marketing, and when you think of marketing, think of positioning yourself against other options that physician has. I constantly go back to that, the Tim Ferriss 4-Hour Body, which I had seen elsewhere, but he definitely popularized it more than anybody else, which is the 5-step process of how do you handle a musculoskeletal injury. Number one is movement, so that's corrective movement exercise. Think Egoscue method, McKenzie method, things along those lines. Step number two is mobilization. So if step number one fails, you go to hands-on therapy. Step number three is medication. 4 is injection. 5 is surgery. The physicians that you're marketing to, especially if they're orthopedic specialists or working within a hospital system, they're usually very biased to 3, 4, and 5. So if you step in with number one, the very first thing they're going to ask is, how did you do that? You better have an answer prepared for that. And perhaps we'll save that for another marketing thought of the day, but you want to have, you want to be prepared for that question, and you want to have a very smooth answer. Personally, I want to show them, I don't want to tell them, I want to show them what we're doing. So that's where I'll pull in an office staff member and treat somebody cold turkey, to completely put my reputation on the line, but treat somebody cold turkey right in front of the physician, or I want to treat that referral source right there. So do you have any trouble with your neck, shoulders, anything like that? If I see them moving in an odd way, like I was just in a physician's office for a lunch, he came limping in, and I said, what are you doing? I thought you were joking around. And he said, no, I've had hip pain. I ended up having a hip replacement, ended up with a hip flexor contracture, and immediately scheduled to come in for PT. Once he goes through the results that we can produce for him, it's an easy sell. It's so much easier for him to refer other people to PT than it would be if he had never had not experienced us before. It's like, can you possibly sell a car to your friend or convince your friend to buy a car that you don't actually drive yourself? If you're driving a Civic and you say, hey, you should really get that Corolla, that's going to be a pretty weak referral, other than you might not like the Civic. But for right now, just stick to the idea that marketing is positioning. Also, what are we positioning against? Well, we're positioning against 3, 4, and 5. You can watch the Phil Mickelson commercial where they list the side effects of Enbrel, which is an arthritic medication. One of the side effects is lymphoma. So I don't know anybody who's ever gotten lymphoma from doing physical therapy. But just as an idea, you want to be able to position yourself against those other options. So whether that be chiropractic care, other physical therapy, aquatic physical therapy, land physical therapy, McKenzie, whatever that is, massage therapy, other medications, injections, or surgery, you should be prepared to subtly position your services against those other treatment options. And the third step, which is probably the most important step, is sales. And that's what we try to do right away. We go in and, hey, Dr. Smith, here's all the great things about Madden Physical Therapy. Well, that doesn't work really well unless you do step number 1, which is the PR, step number 2, which is the marketing and positioning yourself. Then when it comes time to the sales, it's really a one-step process, which is, hey, Dr. Smith, I see, or when I walked in here today, you said that you've heard great things about us. You've seen the testimonials, you've seen the case studies that we've sent out, the before and afters, and the dramatic effects that we can have for the right patient that is referred to us. You've obviously demonstrated in the past that you know how to test for mechanical back pain or whatever that is, and that you can make a good referral. So can I trust on you to send us some patients? And I will personally follow up with you on how those patients do. Yep, great. So we have some sort of verbal agreement. I don't get them to sign anything, but we have a verbal agreement, and I'm asking for the referral. So, and I asked for it very specifically. Are you going to send us patients? Yes, I'll be happy to send you patients. Great. Well, I'm going to report back to you in 4 weeks, 8 weeks, a month, whatever that is, and report the results of how those patients did to you. They cannot argue with results. They might argue with your technique, so don't focus on technique. Focus on results. It's the biggest button for a physician, and they'll be happy to send you, maybe not the bulk of their patients, as we alluded to, or as we covered in the webinar, the POPTS Killer webinar, which you should watch if you haven't already. They may not refer the bulk of their patients to you, but you'll at least get the VIPs, and you may even get to treat them. So hope that helps you out in your marketing plan with physicians.